Until everyone is safe, no one is safe, except by the Director General for Ghana Health Service at the launch of 7th National COVID-19 Vaccination Days campaign organized by Ministry of Health and Ghana Health Service with the theme Protect Yourself, Protect Your Family, Get Vaccinated Against COVID-19. Speaking with the media, the Director General of Ghana Health Service, Dr. Patrick Kumabwaje, said,
These vaccines have yielded positive. Yesterday, as was said, we have one case, one active case. That seems small, but it is small because it's not you. If it is you, it's 100%, isn't it? Okay. Nearly 26 million doses of COVID-19 vaccine have reached almost 14 million persons, out of which 10 million persons are fully vaccinated. While this is commendable achievement, the country is still far from achieving this national target. This means that the whole population still stands at the risk of a likely event of new variants as COVID-19 remains extremely unpredictable. And I must say, as you saw the program manager present, this total dose represents about 34.46% of the population. What it means is that almost 70% or a little over 60% of the population are unvaccinated, isn't it? But the vaccine, COVID, even though we are not vaccinating children, COVID can affect children. So we still have a lot to do to ensure that as many people are vaccinated as possible to increase our protection. The country continues to learn from recent new cases and active infections in many countries. As you have heard, including China, we have outbreaks in Philippines recently, Vietnam, the USA, Poland, and Brazil. With continuous new infection, the virus still has the capacity that is far away. That is not too long ago, and so we had a death in January this year. Dr. Chair, as you may recall, on the 5th of May 2023, the WHO Director General, through the advice of the International Health Regulators, now and established an ongoing health issue, and which no longer constitutes a public health emergency of the national concern. They didn't say COVID was over. It is now established. The declaration does not mean, as I said, that COVID-19 pandemic is over. What it means is that under the international health regulation, the management of COVID-19 is taking a different approach, that is integrating COVID-19 into existing health delivery mechanisms. The WHO therefore recommends that countries maintain efforts to increase COVID-19 vaccination coverage for all persons to maintain the gains made in our fight against the disease. I have been said earlier, currently over 4 million persons who qualify to receive the COVID-19 vaccine are yet to do so. And an additional 3 million are yet to get fully vaccinated. To protect the population more effectively, it is critical that all eligible persons receive the full dose of COVID-19 vaccine. In view of this, the Ghana Health Service and its partners are rolling out the 7th National COVID-19 Vaccination Days campaign from tomorrow, that's the 19th of July, to Sunday, 23rd July 2023, across the country. This is closer to our target as we prepare to integrate it into our routine immunization program. Vaccination continues to be a critical tool that has not only protect us as individuals, but also safeguard our families, friends, and communities. It is an act of solidarity, an act that demonstrates our commitment to the greater good, and so all should make sure they will be available at all facilities and temporary health posts to administer the COVID-19 vaccine to all persons 18 years, 15 years and above. In addition, mobile teams will move to towns and communities, areas and market areas to vaccinate people. Let us remember that our fight against COVID-19 is not yet over. We must continue to follow our public health guidelines, practice good hygiene, and remain vigilant. It's something that we need to not just only practice, we want to try to put some of these things in our building code. We must continue. The virus has shown its ability to change, form, and evolve, reminding us that we must stay one step away ahead of the virus. Today, as we march, we launched the 7th COVID-19 Vaccination Days campaign. Let us look forward with hope, resilience, and determination. Let us stand united in our commitment to protect one another and build a brighter future. I will continue to urge all the city executives, our regional ministers, to continue their leadership roles in the districts and regional levels in this noble fight against COVID-19. I also call on all civil society organizations to continue to put all hands on deck to consolidate against me in the fight against the spread of COVID-19. Enjoy an important role in influencing the behavior change. You have been very supportive, and I urge you to continue using your platforms to encourage people to take the vaccine. Support the Ghana Health Service to educate the public and address misinformation and disinformation by verifying information on the vaccination process from the Ghana Health Service. Distinguished ladies and gentlemen, the significant gains made in controlling COVID-19 so far could not have been possible without our partners. And I wish therefore to thank all our WHO, UNICEF, the World Bank, Global Fund, European Union, USAID. The success of this vaccination exercise requires our collective efforts. Until everyone is safe, no one is safe. It is now my singular honor and privilege to declare the 7th National COVID-19 Vaccination Day campaign duly launched. Thank you, and God bless you all.
It has a lot to do with the population. It's a proportion game, so if the population is not huge, it's a lot easier to reach that. In the urban areas, because of the way we live, we move in and out, so that's why it's difficult to access. And that's why we have problems of shelter and even though we may have a high percentage, but in terms of the actual number of people who are not vaccinated, and that's what killed the distortion. But we need to show that we intensify and that has actually pushed us very far. If you look at the absolute number, you can see that the large millions of people have been vaccinated in Accra and Kumasi, but it's still a small proportion. So we're still going to ensure that we reach more people, intensify the very approaches we are using, and ensure that media also helps us to encourage people to get the vaccination. I think that announcement was, for us, what was needed to move from the emergency phase into a more routine phase, because what it means is that the disease has been established. Just like yellow fever came many years ago, normal flu came, the flu came in not long ago, but it's still part of us. And so what we are trying to say that as part of the effort, as countries must take up steps to prevent the spread of the disease, and that includes the most important strategy is vaccination, where you give yourself the protection and you are able to prevent the disease from one person to another. So it doesn't mean that the disease is wiped out of the world. What it means is that it is not of international concern, primarily because the variant now is not doesn't cause severe disease, but also a significant number of population in the world are vaccinated, and that is what we are looking at, and that's why we need to continue to push our game. What we have here, we are vaccinating 15 years and above. What it means is that about 25% of the population who are below 15 are not going to be vaccinated. And so getting a herd immunity means that you need to vaccinate as many people of your target as possible to be able to provide protection for the children, you cannot vaccinate. And those who, for some reason, are not eligible for vaccination. But I think has always been the misinformation, and then the fear, and then the low risk perception. The low risk perception that the thing that is going to happen to you, but not me. But what we have noticed is that when the vaccines are taken close to them, we are able to overcome that challenge. Because that's why we are doing outreaches to the people to ensure that even though they may not feel that they are not at risk, but if the vaccine is provided, they are willing to go. They may not travel to go and queue and have it, but if the vaccine is taken to them, and that approach has really helped us, and we continue enforcing that until we meet our target.
Eligible. For now we have eligibility that we say 15 years plus. Of that ambition, we have done 59, almost getting to 60% fully vaccinated. Fully vaccinated means they finished a dose of Johnson & Johnson or 2 doses of the other vaccine, Pfizer, AstraZeneca, Moderna, the ones we got. Everybody who is qualified or eligible. We've done 59% fully vaccinated. The eligible was approximated to around 20 million, but it's actually around 18 plus.
80 million plus. Can you
Look at the people who qualify to receive the vaccines that are available now? It is 18 million plus.
Okay.
Approximated to around 20 million. But if you want to look at the entire population, then it's around 32 million. But the vaccines are not for everybody yet. Until we get vaccines for everybody, then our target will change. And for now, it is eligible as we have it. There are several diseases that we are protecting against that are not necessarily under emergency, like measles, like polio. Even though polio is under emergency as I speak now, measles, yellow fever, and so on for the kids. So the fact that something is not a public health emergency of international concern doesn't mean that the disease is not there. So I'm likening it to diseases that we had even before. We are so vaccinated. But if you don't do that, usually the virus might change its form and become more, for want of a better word, more ferocious or more dangerous. So, vaccination is preventive.
It's magical.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.